Welcome to the latest edition of Optima YouTube Live. So, this is a monthly session where we have talks on various medical conditions as well as health related topics. And the objective is basically to help patients understand more about their conditions as well as for the general public to get more information about health related topics. So, this is usually held around the 15th of every month. So this time it got a little bit delayed and we are having it on the 20th. So the topic for today's discussion is fibromyalgia. And to talk about fibromyalgia, we have with us Dr. Vikram, who is a consultant rheumatologist here at Optima. Thank you, Dr. Vikram, for taking time to attend this session.
Thank you, Dr. Sharath. Pleasure to be here.
So during the session, Dr. Vikram will be telling us about fibromyalgia and telling about what it is and other aspects with respect to an introduction with respect to what fibromyalgia basically is. During that time, if anybody has any doubts, please do put in your doubts into the comments part of the YouTube, and we will try to address them during the talk. If not, definitely we will address them after the talk. So with that, let's just start off. Dr. Vikram, what is fibromyalgia?
Yeah, I think that's why we are here. And fibromyalgia is in simple terms, it's a long-term condition which is associated with widespread pains. Okay, in simple words, this is the most important part of fibromyalgia. It's a long-term condition with widespread pains, and with widespread pains, there can be fatigue, there can be sleep disturbance, there can be uh, difficulty or decreased ability to think clearly, affecting your mood, etc. So this long-term condition with widespread pains associated with sleep disturbance, fatigue, is what is fibromyalgia. So if you listen to just what I said, is not a single thing; it's multiple things. So that is why it's not a disease per se; it is called a syndrome, because there are multiple aspects to this. And since we have multiple things to take care, we call it as a fibromyalgia syndrome.
Uh, uh, as you correctly pointed out, that many patients come with pain, that is their primary problem. But sleep disturbance, fatigue are also equally important aspects of this condition and seem to significantly affect the patient's quality of life as well. So, one thing that patients always ask me, which I am asking you, is that what is affected in fibromyalgia? Is it that are the patient's joints, that there is some problem within the joints and that is why they're having pain? Is it a problem with respect to their muscles and that is why they're having pain? Or is it an autoimmune disease and that is why they're having pain? Or what is exactly the problem in fibromyalgia?
Yeah, to be frank, Dr. Sharath, you also may be aware that's a $1,000,000 question. Still, worldwide research is going on to find out what exactly causes fibromyalgia, what exactly happens in fibromyalgia. But what we understand as of today is that it's probably your nervous system, which is probably hyperactive, or to put in simple terms, your nervous system, uh, the volume of the pain setting is up. Okay, so there is something called a central sensitization, where the brain and the spinal cord perceives the pain more than the usual. And this we believe happens because the nervous system is overactive. To put in simple terms, we know that in response to stress, so suppose uh, we are under stress, or we suddenly somebody bangs on the door loudly, uh, we suddenly get tight and stiff. What is happening? Our body, heart rate increases, our muscles tighten. So we have something called as a fight or a flight response. That is, we either are ready to fight or we are ready to run away. So this is good for us because it helps us to uh, come out of certain critical situations. Suppose your tiger is chasing you, so you would need this response. However, But this should be a short-term response. If our body is in this sort of response continuously, something similar to what happens in fibromyalgia would happen. The nervous system is activated constantly, and that leads to, in a long term, increased sensitivity to pain. It affects your sleep. It causes, and this leads to chronic fatigue as well as ability to think. So in fibromyalgia, the pain is not just, when I say widespread pain, um, we mean pain all over the body. So even the right half of the body is painful, the left half of the body is painful, the upper part is painful, the lower part is painful. So there is not just one region which is painful. It is not a localized pain. It is pain all over the body. So objectively, we assess using certain areas. We have 19 areas, and patients have more than 7 out of them is also considered significant. So majority of the body is painful. Okay, so this is one of the characteristic features of fibromyalgia, and many patients have associated problems apart from these what we discussed, that is the pain, fatigue, sleep disturbance, and this brain fog. They also may be having associated anxiety, depression, irritable bowel syndromes. Their gut seems to be erratic. uh, so this is what happens in fibromyalgia. And to put in a nutshell, we this is what we understand about fibromyalgia, what causes fibromyalgia, what happens in fibromyalgia as of today. But there is still a lot of ongoing research, and hopefully sooner than later we will be able to come to a conclusion what really triggers or starts fibromyalgia.
Okay. That example was very interesting, where you said that, just like a TV has a certain volume, and then sometimes if there's some problem with the TV and it's blaring out, the volume is very high. Similarly, our nervous system, when we have some problem, we're supposed to feel a particular amount of pain. But in patients with fibromyalgia, as you described very nicely, they will feel much more pain than would normally you would feel. So basically, it is something like the volume has been really turned up, and that occurs because of problems in the nervous system, and partly could be related to chronic, as you said, flight and fright response. So, does that mean that fibromyalgia affects only people who are, like, you can say, stressed out, or does it affect? Is it a condition which is associated only with stress? Who does it affect particularly?
Yeah. So fibromyalgia affects nearly 2 to 5% of the population, general population. So that is a big number actually. Worldwide prevalence is, they say, is around 2 to 5%. In India, there's some studies around 2%. So that means around, if there are 100 people, nearly 2 to 5 of them may be suffering from fibromyalgia. So that is a pretty high number, more common than most of our autoimmune diseases put together. So it is not uncommon. It is pretty common. Unfortunately, it is underdiagnosed, underreported, and many patients don't know exactly where to go. So that is why probably the reporting is much less. Uh, whom does it affect? So it seems to affect women more than men. Okay, and it is almost 7 to 8 times more common in women than men. Now, that this is not only in India; it's worldwide. Worldwide, women seem to be affected very significantly, especially in this age of 30 to 50 or 20 to 40 age group. So this is the most common. Middle-aged women are more likely to be affected by fibromyalgia rather than any age group. Yes, it can be seen in younger patients, it can be seen in older patients, it can be seen even in men, but this is the most common age group which is affected by fibromyalgia. Now, coming back to your point, where that is stress the only reason, this is one of the reasons. It was probably one of the triggers. They say that there is some, probably in some people there is some genetic risk also. There are a lot of studies on that. So probably in some families are more likely to have fibromyalgia. But in presence of this, certain triggers, so which one of them or most common trigger is usually stress. There are some infections, that could be viral infections also, which can trigger a fibromyalgia like illness. Like so we have a one simple analogy, something like a post COVID sort of people had widespread pains and aches for long term, something similar. So one of the theories is that even viral illness also may be a trigger for fibromyalgia. So this is what we understand so far. It affects young women or middle-aged women more commonly, and it is stress is probably one of the triggers. Others could be infections.
Okay. So, when you said that women are predominantly affected, is there any particular reason why women are more commonly affected with this condition?
Now, if you look at the age group which is affected, now we can try to sort of analyze why it could be. Now, young middle-aged ladies, women, probably in that sort of phase where it could be marriage, it could be work, it could be children, it could be family. In Indian settings, this is the most common scenario where marriage and change of environment, motherhood. So these are probably the biggest stressors. Whether you agree or not, it is these are stressors. So this probably could be one of the reasons. Where these triggers, probably the stressful situations which are constant, may be a reason why fibromyalgia is more common in women. But there are no definitive reasons, or no definitive other better explanations. This probably could one reason why it is more commonly affected in women more than men. At present, this is what we understand.
Okay. So, in between, we have like a couple of questions. So, one question is about why does the fibromyalgia pain move around? And the second question is asking why does weather affect the symptoms of fibromyalgia? So, would you like to answer those questions, Dr. Vikram?
Yeah, if I the
So, why?
first question is, why does it move around?
Yeah,
Yeah, so fibromyalgia patients have pain all over the body. So, and majority of the parts, as I said, it has to be a widespread pain, upper half, lower half. The pain can be again triggered by some pain generator. So, so if somebody has some injury or some exercise in certain area, that could be a pain generator. Tomorrow there could be some other pain generator. So that way, different pain generators can trigger the pains. So that's why probably you feel that it is moving around. And second question was about weather.
weather and
Yeah. So
pain of.
certain patients do say, today exactly, I had a patient of fibromyalgia who said that in summers I feel much better compared to winter. So for reasons which is very similar to all our other arthritis patients also, the temperature, the humidity, uh, also probably the muscle tightness, especially in cold temperatures. These also may be the reasons why they tend to feel more pain during excuse me, during colder weather rather than a warmer weather. Uh, so these are probably the reasons why there could be variation in with respect to temperature also.
Yeah. So, and basically, the temperature can increase the sensation of pain, but
Pain.
as such, it doesn't worsen the disease per se, right?
Correct.
As
That's what we say in arthritis also. They feel the perception of pain is more. It doesn't increase the disease, but patient, that's right. The patient feels better during summer compared to winters.
So we are talking a lot about pain, but you also mentioned that patients with fibromyalgia can have other problems as well. You mentioned something called brain fog, which I think many Indian patients or many Indian people are not aware of the term brain fog. And also, you said sleep disturbance. Exactly what happens during that sleep disturbance, and the fatigue, what kind of fatigue do they experience, what are the other problems, overall symptoms that they experience? Would you like to elaborate, Dr. Vikram?
Yeah.
Can you elaborate?
So sleep is affected, in majority of patients. That is a very characteristic feature of fibromyalgia. It's as if they are sleeping with one eye open. Even a small, tiny stimulus, a door slightly opening or any mild sound, they feel that they get up. So the body is always in a mode to or very active or hyperactive mode. So that is a very common analogy given, as if you're sleeping with one eye open. Even a small thing sort of wakes you up. So patients find themselves getting up in the middle of the night again and again, and once they get up, they find it very difficult to go back to sleep. So this is a very common scenario. Most patients with fibromyalgia would have this symptom. The fatigue, the body soreness.
So the sleep, basically, the problem with sleep is related to the quality of the sleep and not the quantity of the sleep. Is that correct?
Yes, predominantly it is the quality, but yeah, to some extent, uh, patients also do complain the number of hours in also would be slightly reduced compared to what usually would see. But it's main the quality of sleep, and that also affects your body pains. That also is responsible partly for your body pain, fatigue, as well as your brain fog. With the brain fog, patients complain that they're not able to, once they get up, they do not feel refreshed. So, what we usually should, when you have a good night's sleep, so you want to, when you get up, you feel fresh, your body is light, you feel you're able to think clearly, you feel that you have a good rested sleep. But patients with fibromyalgia feel they do not have a rested sleep, even though this, this the number of the quantity they may be good, but the quality is poor, and that's why when they get up, they feel that they're still sort of not feeling fresh. They feel feeling tired, not very able to think clearly, and people also complain of memory issues. They tend to forget when we are for regular jobs, what I have kept here, what did I do there, what was I supposed to say. These common things, these short-term memories, this is commonly affected in fibromyalgia. And also one more common thing which patients complain is their full body seems very sore and tired. It's like as if you have gone on a long flight journey. How do you feel? You feel as if your body is tight, it is stiff, it is sore. So patients complain this throughout. So they have this feeling as if when you feel that you have gone on an 8-hour journey or a 12-hour flight journey, you're sitting constantly, your body feels tight and stiff. So patients also complain similar to that, which is always there. So these are some of the common features of fibromyalgia. Apart from this, many patients also complain of digestive issues. Gut motility is affected. They may be having constipation. They may be having IBS like symptoms. So, because we know that the gut is controlled again, the by the brain, or the neurological control is there. So, most patients also complain of gut issues. Uh, Bowel movements are affected in fibromyalgia.
So looks like almost a lot of, organs are not actually affected, but a lot of symptoms can be associated with fibromyalgia. So you mentioned about COVID and how long COVID is very similar to, at least the experience of long COVID is very similar to what patients with fibromyalgia experience. So we have a relevant question from Bairu. Bairu is asking, what is the difference between fibromyalgia, chronic fatigue syndrome, and long COVID? And how do the doctors actually separate them?
Yeah, that's a great question. It's very it's very difficult, and many times it's very difficult to delineate or differentiate. So chronic fatigue syndrome is more like when you're in response to certain infections, when the immune system gets activated and sort of gives these sort of symptoms, where you can have fatigue and tiredness. It's basically an autoimmune, your immune system's response to certain infections. So that is where chronic fatigue syndrome is seen in certain settings. They can have associated other features of viral infections. They may be having fever or some lymph node or other features also may be there. Whereas fibromyalgia will not have those symptoms. Fibromyalgia does not have any fever or any constitutional symptoms or other features suggestive of any definitive viral infection. Though we know that we assume it's a viral trigger, but we don't have any definitive constitutional other features of viral infection. That is where the chronic fatigue syndrome is slightly different. Post COVID is a very new thing, which obviously there was no previous record or report, because COVID, many patients after COVID developed long term body pains and aches, which we felt was a long-term post-viral like syndrome. We have patients with viral infections who can come with later on with joint pains or rash and other triggers. So it's basically your immune system gets activated and sort of causes these sort of symptoms. where you can have body pains and aches, which goes on, fatigue, which goes on for months or years together. So, main difference, obviously, chronic fatigue syndrome can have other features associated with the viral infection. It is basically our immune system getting activated. Whereas in fibromyalgia, we are not really sure. We believe it's the neurological nervous system which is hyperactive. So that is a fine difference. Obviously, the symptoms can be very, very similar and overlapping, and many patients are not able to exactly delineate the two because we don't really have a test. We don't have a test to say that this is blood test or this is a fibromyalgia. It's more of a clinical diagnosis.
So, you mentioned that there is no test for fibromyalgia. So, in fact, Chitra Yadav is asking if labs and scans look normal, then where exactly is the pain coming from? Or what is fibromyalgia actually doing to the body? So, I
Yes.
think we can address that first before going on to discussing about how to diagnose fibromyalgia.
Correct. And that is the problem with fibromyalgia. Many patients are not taken seriously. The families and other families will say that they may not, when patients complain of these symptoms and the tests are normal, many people will say that this is all imaginary and you don't have any disease. Many doctors, obviously, because the tests are normal, we're not able to diagnose. Patients move from doctor to doctor. They go to a neurologist, they go to an orthopedician, they go to a physician, they go to an endocrinologist. They want answers and they're going around. So this is the problem with fibromyalgia. It seems to be nobody's baby, because the symptoms are so widespread. The blood reports are absolutely normal. So patient, especially women, or many people would say, no, it's all in your mind. You don't have any problem. You're just thinking. Your thinking is wrong. So this is the problem with fibromyalgia, that patients are not taken seriously, and unfortunately, because this is so widespread and blood reports are normal, there is a lot of delay in the diagnosis, and these patients suffer from years together because the test reports, that there's no single blood test for me to say that this is fibromyalgia. So that is the point regarding the blood test. Now, how do we diagnose fibromyalgia? So, as you said, there should be widespread pains and there should be these associated problems. So, we have some objective criteria for diagnosing fibromyalgia, where we have something called as an ACR criteria, where we have objective scores. We score the pain, where we ask the patient to score to see mark where all they have pain in over the body, and then we see their score of fatigue. So we have a score of 0 to 3 for the fatigue, waking unrefreshed, and cognitive symptoms and associated symptoms. So we score all of them and we get a cumulative score, and we say, okay, fine, if this plus this is more than a particular number, we say that you have fibromyalgia, especially if it is more than 3 months. If the symptoms are more than 3 months and you have ruled out some other associated, see, fibromyalgia can be associated, it can be a disease in itself, it can be associated with other diseases also. So we need to rule out sometimes some other things which can also mimic like fibromyalgia. So whenever we don't do tests to diagnose fibromyalgia, blood tests, but we do tests to rule out other causes. Say somebody has very low hemoglobin, or they have a thyroid issue, or they have some vitamin deficiencies, or sometimes some patients have may have some autoimmune disease like a spondyloarthritis, or rarely there's, as you know, as you also have seen a couple of patients who had actually see a very rare instances of malignancies also which look like fibromyalgia. So we do tests to rule out other rarer causes of widespread pains, but not to rule in or not to diagnose fibromyalgia.
So that's a very interesting point you made, that there are no tests which can help us to confirm the diagnosis of fibromyalgia, no lab tests. So basically, as Dr. Vikram so nicely pointed out, there is a form that needs to be filled, which is called the ACR criteria, and based on the score that the patients get when they fill the form, or when the doctor fills the form on the behalf of the patient. So, basis of that, we are able to confirm the diagnosis of fibromyalgia in many patients. But it's obviously very important to make sure that they don't have any other problems, which, for example, as Dr. Vikram said, cancer or some arthritis or other diseases, which can cause a lot of pain and can seem like fibromyalgia, and that is why tests are done. Referring back to Chitra's specific question, that what is fibromyalgia actually doing to the body? Chitra, Dr. Vikram already answered that. Basically, it is a neurological problem where the nerves are getting affected, and therefore, though there is no problem in any organ or joint in the body, there is continuous pain signaling which is happening in the nerves. That is one of the simple ways in which we can think about fibromyalgia. So that is where the pain is coming from. The pain is coming from the nerves. It is not coming from any particular point or organ in the body. So Basaraj is asking that if fibromyalgia affects women disproportionately, do men not get fibromyalgia at all? I don't think Dr. Vikram said that men are spared, but would you like to elaborate, Dr. Vikram?
Yeah, yeah. I mean, I mean, men are affected, but women are affected nearly 7 to 8 times more commonly. So, if women, yeah, say out of um, the prevalence in men is around 0.5 to 1%. In women, it is around 4 to 5%. So, it is nearly 7 to 8 times more common in women. But yes, it can happen in men also. But if you have fibromyalgia in men, especially if they're obese, we always also look for other problems like an obstructive sleep apnea. So this is also one of the reasons for widespread pains, not only men, even women. But if men are affected with fibromyalgia, especially if they are on the obese side, if they have history of snoring, we always try to rule out a condition called as obstructive sleep apnea, where when they sleep, the tongue moves backwards and blocks the airways, causing low oxygen in the body and causing widespread pains. That is also one of the which can mimic fibromyalgia or look like fibromyalgia.
So we were talking about pain as one of the predominant symptom of fibromyalgia. What are the things which can worsen the pain? What are the things which can trigger? Because Shilpa asked, what kind of movement actually helps versus trigger flare of pain in patients with fibromyalgia?
Yeah. So uh, any stress obviously can trigger your symptoms of fibromyalgia. Lack of sleep can affect your fibromyalgia. Deficiencies, associated problems like any pain generator. So somebody has arthritis also can have fibromyalgia. In fact, nearly 15 to 20% patients of rheumatoid arthritis or lupus also have associated fibromyalgia. So those can also can be a trigger for fibromyalgia. Um, so any infection also may sometimes trigger fibromyalgia. So these are some things which can make your pain worse or be a trigger for fibromyalgia.
So that's a nice listing of all the possible triggers of fibromyalgia. So in addition to that, I'd like to add because Shilpa's specific question was about movement.
Movement,
So
yes, exercise. Yeah, exercise also can make your pain worse, especially patients with fibromyalgia. So patients with fibromyalgia, we suggest that the pacing of the exercise, stretching before going for exercise, and adequate cool down time. So you do exercise, give adequate rest, and then go for exercise. So be careful when you go for patients with fibromyalgia are advised exercise, but how they do it, how they stretch, and how they cool down after exercise is important.
yeah, and gentle movements are the ones which are we generally recommend to patients to start off with.
Yes.
Ideally, we would not want a fibromyalgia patient going to the gym first day and spending like 1 hour there or something, lifting all heavy weights without doing any proper warm up. We would want them to start off with some kind of gentle activity,
Perfect.
something like even brisk walking or gentle movements in water, or even there is a Chinese type of yoga which is called Tai Chi,
Thank you.
which has been shown to be quite useful in fibromyalgia, where it consists of very slow and gentle movement of the hands and legs. So similarly, very mild form of yoga might also be useful in starting off about fibromyalgia. So I hope that answers your question, Shilpa. With respect to more about exercise, we will be discussing that in later sessions as well. So you talked about tests that we would do for ruling out other problems in fibromyalgia. So what are the tests that a patient who say, let's say a patient has symptoms similar to fibromyalgia with pain everywhere and all, what are the normally the number of tests or the amount of tests that they would have to undergo?
Yeah, Dr. Sarath, this is not a single answer. It will be very, there's no one package or one test which fits all. So based on the patient history, and when we examine the patient and they look at the background, and we look at their metabolic, we look at their weight, and we look at their associated diabetes, hypertension, hypothyroidism. When we analyze the history and we go through the examination, then we come that okay, these are the possible reasons which can be more likely to be a cause for fibromyalgia. So some of the things which we would commonly do for everybody is the general routine hemoglobin, maybe as inflammatory parameters. We just look at their thyroid function, sugars, and maybe commonly the lowest hanging fruit for us is a vitamin D or a B12. We would also will be checking. So these are some of the common routine tests we would do. But if somebody has joint pain with swelling, then associated problems, we will also look out if they have arthritis, and if they need for evaluation for arthritis or lupus or other autoimmune diseases, we would do that. If somebody is obese, probably we'll also try to see if they need a sleep test to see if any obstructive sleep apnea is there. These are some of the tests which we would do. Or some patients have associated weight loss, or they have some lymph nodes or other things, and we examine. Then probably if they need an evaluation for a malignancy, then we would do that respective malignancy test also. So there is not one single test or group of tests which we would do. It would depend on when we see or examine the patient, take the history, and then decide probably these are the some of the tests. Some would be common for all, but certain extra tests would be depending on the clinical scenario which we would decide for fibromyalgia. I may have missed a few. Probably if you can, if you feel it needs anything else, but this is what comes to my mind.
Yeah, I think you've got all the tests. But as you mentioned, these tests are basically to rule out other problems.
Other problems here.
Generally, as Shilpa, one of the persons who commented previously or asked a question previously, also said that many times in fibromyalgia, all the tests come back normal. Right. So it's not when a patient with fibromyalgia comes and we order tests, it is basically to rule out other problems rather than trying to find out some abnormality in the test which can be corrected or treated, and therefore the fibromyalgia can disappear. That is not the intention with which we ask for tests. I just wanted everybody to who's watching to know that. Arun asked a very pertinent question that can you die from the amount of pain that you face due to fibromyalgia?
Uh, Not really. We've not come across somebody who has died from fibromyalgia per se. Um, that is not something which would, it would not, it's not an emergency or an condition. It can be, it is disabling, it is cause a lot of morbidity, but not mortality as such. Patients with fibromyalgia can die with any other cause, but not exactly due to fibromyalgia.
Absolutely. So, Arun, though the pain can be very severe in patients with fibromyalgia, you cannot die from pain. In fact, you cannot die from pain due to any disease. You die from the disease rather than from the pain related to the disease. So, though it can be very disheartening and very distressing to experience that amount of pain, definitely it is not something which can lead to death per se. So today, Arun has also asked about painkillers, but I think we will be addressing that in future sessions. We are already we have these talks for 30 minutes, and we take questions during that time. So we are already the time is up. So during this session, Dr. Vikram told us about what fibromyalgia is. That it is a pain condition which is basically involving the nervous system, and because of that, patients can experience severe pain. In addition to which, they can experience sleep disturbance and fatigue as well. Though we do not know the cause of this problem, we there are certain people in whom it is more likely to occur, and that is women, especially in 30s to 40s. Stress is something which seems to be affecting this condition and maybe predisposing to this condition as well. There are many tests which can be done for patients who have fibromyalgia, but these tests are to rule out other problems. There are many other problems which can either mimic fibromyalgia, meaning look like fibromyalgia, or can be associated, meaning it can be present along with fibromyalgia. So the tests are to look for other things, whereas fibromyalgia itself will not cause any abnormality in the tests or in the scans. So we've talked about all of these points till now. Dr. Vikram, anything that you would want to add to patients with fibromyalgia who are watching with respect to what their condition is and with respect to their symptoms?
Yeah, to all the patients with fibromyalgia, fibromyalgia is a real disease. It's not an imaginary disease. Though we do not have blood tests, your symptoms are real, and they are really affect in multiple ways. And with there are ways where, though we do not have a blood test, we have ways to diagnose this objectively, and we have ways to manage it, not only with medication but a combination of other things which we will be discussing in future sessions. So this is the bottom line. Fibromyalgia is a widespread pain disease associated with sleep disturbance, fatigue, and cognitive dysfunction. And patients who feel they may be suffering from this, please should reach out to specialists, especially rheumatologists who all manage these conditions. And not only as a single doctor, but we would obviously be a team of doctors along with psychologists, physiotherapists, and pain management specialists as a team with who manage this, about which we will be discussing in future sessions.
So thank you, Dr. Vikram. So
Thank
I
you.
think hopefully this had been a very useful session as an introductory to the condition of fibromyalgia. We will have further sessions during Optima YouTube Live, which is done, as I said, every month on the 15th of every month. And in future sessions, we might be discussing treatment with respect to medications, with respect to things that you can do to improve your sleep, things that you can do to improve your fatigue, that is non-medical measures that can be implemented, how stress affects this, exercises that needs to be done or not done in patients with fibromyalgia. All of these will be discussed in future sessions. So with that, I would like to thank Dr. Vikram for enlightening all of us about fibromyalgia and hope to see him in further sessions as well.
Thank you, Doctor. Thank you, everyone.
Bye.